Welcome to From the Front Line with Ed Kelley. I'm your host, Ed Kelley. We discuss both global health and biopharma topics here on our podcast. And today we're excited to have Michael Free, who has dedicated his career to global health and increasing the availability of health technologies designed for resource-poor settings. Michael, we know each other for a long time, and it's really a pleasure to have you on. But can I ask you to tell us a little bit about yourself?
I'll do my best, although I don't like to talk about myself usually. My career started somewhere in the early 70s. I was lucky enough to be working on reproductive issues at a time when the international community was intensely interested in population and family planning. And I was invited to work at a not-for-profit called Battelle to look into finding new ways to provide products for family planning that would be appropriate for low-income countries and communities. And that got me into working on initial issues in male and female reproductive health. Near the end of the 70s, was also fortunate to be present during conversations with a couple of folks from the Ford Foundation and Battelle around the issue of how we were going to get health products to the developing world without and the obvious need to develop trustful relationships and collaboration between the private sector, commercial sector, and the public sector. That's something that was lacking at that time. And so we launched a new organization that became known as PATH, or Program for Appropriate Technology in Health. And I was able to then develop an innovation center and a product development team and work on a whole range of technologies that took me through the next 30 years, having some successes, enough successes to stay excited, I suppose you could say, and enough failures to stay humble. And it took me to near the late 90s when it became obvious that the other issue was getting those innovations to where they could have impact. So at that time, I also was able to collaborate with other founders to launch another organization called Village Reach, address the issue of last mile. How do we get these innovations to remote villages and communities or even underserved communities within urban areas? This is what Village Reach was designed to address and has now done so effectively for the last 20 years or so. So nearly 50 years of actually now addressing and trying to be helpful in terms of healthcare, improving healthcare in these low and middle income countries.
Great, Michael. Thank you for that, condensing what is an amazing tour there and actually knowing the broad strokes, but not some of the details. That's great to hear again. But maybe we can even just start from the basics for, some of the listeners to the podcast are people who work in global health, some not, some are familiar and feel like they know the term innovation, and some may be wondering what we're talking about. There's probably very few words that are used more frequently in healthcare than the term quote unquote innovation. But you've, as you were just talking about there, been one of the pioneers around both creating innovation, assessing it, and then getting it into the field, to the places where it can be most useful. For innovation in global health, how would you, someone who's worked in it your whole career, how would you define innovation?
Well, there's a big question. Well, certainly it means doing new things, and I suppose also all things in new ways. In our context, of course, in the space we work in, it's usually about products leading, or acts of imagination, I suppose, leading to products. So when it comes to products, innovation really is essential, but not sufficient, because unless an innovation has ultimately impact, it's pretty useless. And to achieve impact, there needs to be a lot more effort and a lot more inputs from other innovators, people who have multi-skill ability to muster resources. Of course, unless the innovation, unless the product arising from innovation can become commercially successful in this world and achieve a large scale, it's unlikely to be sustainable, and therefore, as good as it may be, it may never achieve impact. So the notion of innovation, it doesn't sort of stand alone in our world. It's the notion of this complex, multi-skill, sort of large process that's required to achieve sustainable availability at scale, and to make sure that the innovation can be adopted by the intended users and beneficiaries. And we always, back in that path, we used to think about the need to achieve the A list. We call it, which means appropriate, available, affordable, accessible, and now more urgently now, of course, an absence of harmful consequences for the planet. These are the goals now of innovation in the context of global health. In terms of getting innovation out to the global health arena, it has its own particular challenges that are quite distinct, I think, from much of the process in the high-income developed world. There are a lot of stakeholders involved who contribute to the decision of whether an innovation can find its way to where it needs to be. Standardly, we talk about user-centered design for innovation, for example, but I think we've always thought that for global health, it has to be what we call stakeholder-centered design. The range of entities that help to select suitable technologies, like from endorsement, recommendations, for example, authorization, regulation, guidelines. And these people are often separate from those that actually buy the products. And then still other people use the products. So each of these entities really requires a different value proposition. They see the product quite differently. And one in terms of public health impact, another in terms of procurement costs, another in terms of local acceptability and advantage over alternative interventions. And they all have to buy in. That's the key.
This idea of the assessing and managing technology and innovation in healthcare is a fascinating one to me. I mean, there are numerous economists who've talked about basically the appetite we have for technology and innovation in healthcare is almost limitless because our willingness to pay, if there is an innovation or a technology that might save our parent, our son, daughter, or even ourselves, that it'll get developed. So it is a particular field that really has special challenges in regards to the management of technology. And you add on that the additional points which you were just raising over that global health with the constraints of resources, but also these days the leapfrogging in technology. I wonder what you would outline as some of the major challenges regarding the management of technology you foresee in the coming years for global health.
Well, let's say first of all that any challenges in the future are commingled with opportunities, because a lot of the challenges are going to have to do with what we call the constraining or dark side of the new technologies versus the bright and positive side. There are, for example, two world-changing genies out of the bottle in terms of innovation. One, of course, artificial intelligence, and the other, synthetic biology. Interestingly, these both involve platforms coded with information. These technologies now essentially are already around us and being utilized in a variety of ways, not just in healthcare, of course, in practically every arena of human endeavor. In particular, with respect to healthcare, we can expect the possibility of literally a new game changing. I think because of the nature of some of the outcomes of these innovations, initially we're going to see huge inequities arising from them because, the fact that like individualized medicine are going to have a huge cost barrier. But we've all noticed how fast these technologies develop and scale and become sort of distributed in recent decades. And so we can probably expect that they're going to become much cheaper, much more available, and essentially decentralized. that's been the pattern, and it's likely to be the pattern. And in fact, we're seeing that already with synthetic biology, where I think you can literally buy a kit now, to basically synthesize your own DNA in your basement. It's sort of becoming that ubiquitous or potentially ubiquitous. And so we can expect that we're going to see a whole new emergence, if you like, of local innovations even in low-income or middle-income countries arising from these technologies, just like we've seen a sort of leapfrog of communication technologies to mobile phones. I mean, there's no copper wire strung around many of these countries. They all have phones. They've all leapfrogged into a new era of communication. And they're going to have something very, very similar, I think, with these new innovations. There's a lot that could be said about the potential upside of these technologies, but also we have to realize that there are huge potential for misapplication and bad actors taking these up. So the biggest challenge probably for everybody in the world will be containment of these technologies, making sure that they are addressing needs and are not being misapplied, and it'll be a huge challenge.
I couldn't agree more. And such the exciting and also dangerous / challenging times right now, particularly in the world we're living in. So you mentioned AI and synthetic biology. For kind of the last question I had to you was, those are two particular areas that will be a challenge as they develop to address the inequities between the haves and have-nots, both within countries and also between countries. But are there other healthcare products and areas you see expanding the most and having the biggest impact upcoming? And would any of those areas differ radically between rich and poor countries in terms of the access to them, other than beyond AI and synthetic biology?
Oh, for sure, yes. I mean, the other things that are happening in our world, and for example, displaced populations due to war and violence, but actually more and more due to climate-related dislocations. These are already hugely disruptive. They're causing huge geopolitical shifts, and so we can expect that that's going to amplify and become much more of a major issue. We're going to see more and more requirement for sort of pop-up healthcare, pop-up, water supply and sanitation, food, mental health, and particularly mental health. We have an epidemic of mental health that's essentially, it has been sort of hugely amplified during the COVID pandemic, and very, very difficult to address with sort of remote technologies. It requires sort of real face-to-face and empathy, and the sort of inputs that are very, very difficult to scale. And so we have to solve that problem. And it could be that some approaches arising out of artificial intelligence may provide some tools for that, but we have to find a way. We're going to have to find a way to deal with the mental health issues, and particularly in children, as a result of this massive disruption around the world. I suppose another issue is declining populations, because we're talking here about global health, including all of the developed and developing worlds. And in many countries now, we're seeing declining populations, which of course, once they turn the curve, start to decline in the same rate as they rose. And this has basically impacts on the availability of resources for addressing underserved populations. One of the issues I suppose we could also think hard about is the need to facilitate local innovation. I mean, there's no shortage of innovation in low-income and middle-income countries. And what's missing really is resources, of course, and the sort of facilitation of the entrepreneurs and innovators in those settings. But they are well positioned to really focus on the priority health and hygiene products that are most important for those particular populations, local solutions based on local needs, So, and also remember even some of the very, very basic technologies that underscored our own improvement in health in the late 19th century, 20th century, are still lacking in many of the poorest areas, and like toilets, window screens, clean water and hand wash facilities. So there's potential for huge impact in addressing those, and they can be addressed with facilitated local innovation. So that's an area I think to pay attention to.
Thank you so much, Michael, for that. That's going to bring us to the end of this episode. A big thank you to Michael Free, Global Innovation Champion and expert, for joining us. For more information about these topics we've been talking about today, innovation and global health, I'd really encourage listeners to check out the websites of some of the organizations we talked about today, Village Reach, as well as PATH. And we hope that this discussion was beneficial to you. To learn more about From the Front Line with Ed Kelley, please visit our website, apiject.com, particularly in the expert content area. And our next episode we're very excited about will feature a discussion with Heidi Larson on the topics of vaccine and vaccine confidence. This podcast is a product of ApiJect Systems. As always, thanks for listening to From the Front Line with Ed Kelley. From the Front Line is produced by Kate Scott with lead writer Charlotte Mackay.
The views, thoughts, and opinions expressed in the podcast belong solely to the speaker and do not necessarily reflect the views, thoughts, and opinions of the host, sponsor, speaker's employer, or any other organization or individual mentioned.